Hello Jackson College Practical Nursing students. My name is Darlene Lepresto and I am one of your instructors. And in this video I want to show you some of the wound care products that you will be using in class. Wound care products. So the first thing I'm going to show you is the ostomy kit that you're going to get. And we're going to have an assignment where you wear this ostomy. So we're going to pretend that you have a colostomy. You'll wear this adhesive wafer on your stomach, on your abdomen. Here's a skin prep kit. And then this is the appliance. So this is the bag that we hook it to. We'll fill it with a little bit of water. I'll provide you with a clamp and you'll clamp it. Excuse me. And you will wear that for 24 hours and then do reflection assignment on that. So that is your ostomy bag. All right, we have lots of things on the table here to look at and talk about. With some of the dressings that we do, we use cotton tip applicators, and what cotton tip applicators are great big long Q-tips, but they're sterile. Okay, because we don't want to introduce any new pathogens into the wound. So everything is packaged sterile. So those are cotton tip applicators. This is a culturette. We will be doing a culture of a wound, and again, that is packaged sterile. This is a wound measuring device because whenever we're doing wound care and assessing wounds, we have to measure them length, width, and depth. And those are disposable. To clean a wound, we use normal saline. So we always have to check the expiration date. 0.9% normal saline is what we use whenever we're working with wounds, especially if it's not specified by the physician. This is your default. This is what you always use. They come pre-packaged and they're good for 24 hours. We date them when we open them and then we throw them away. This is an irrigation syringe that you will use. It has a piston syringe in it to irrigate the wound with, if the order includes that. This is what it looks like when it comes pre-packaged. Again, it's sterile on the inside until we open it. This is a 4x4 dressing. It has two dressings in it. You'll be working with those. Kerlix sponges. You'll become familiar with these terms. There is usually 3 to 5 per package. And they look thick and fluffy is the best way I can describe it. And those help wick away any drainage that the wound might be producing. This is called packing. And if we had a doctor's order to pack a wound, this is what we may use, along with the Kerlix. This is a drain sponge. Sometimes we call it a T-sponge or the pants because it looks like a pair of pants. And we put this around tracheostomies. We put them around different drains that the patient may have because it has a slit right here. So it can be easily placed around an existing drain on the patient, or like I said, a tracheostomy. So that's called a drain sponge. Again, it's sterile. Here is an example of some Zeroform gauze. This Zeroform has petroleum jelly on it, so it provides moisture to a wound, and it usually comes in like this aluminum foil type package. Here's a product that we have in the hospitals and other healthcare facilities, Safe Cleanse. It's an advanced formula for wound cleaning if the physician happens to order that. Here's an example of how we would secure a dressing with an elastic bandage or good old tape. Here is Medi-Honey. This is a type of calcium alginate dressing. When you get into the nursing homes and the hospitals, you're going to want to try to follow the wound care nurse around if you can, because she knows all of these different dressings and she knows when they're indicated and what works best for venous wounds versus arterial wounds. So she or he will be your best friend, so you need to find them. This red biohazard bag is what we put all our discarded old dressings into so we can properly dispose of them, but the red bag lets everybody know that they're contaminated and that they need to handle them with care. This is called an ABD dressing. It's either 5x9 or this one's an 8x10. This is a large abdominal dressing that we use to put over an abdominal wound after we put the 4x4s on it. Again, it's packaged sterile. You'd want to check the expiration date. And this is what it looks like. It's white with a blue line. We have another type of dressing called Aquacel foam. And again, the wound care nurse would be the best to tell you what kind of wounds these are indicated for. We also have Tegaderm. We use Tegaderm a lot on different types of wounds because you can see through it. It's kind of like saran wrap. And it's got a border around the outside, as you can see. So we can write the date and time and our initials on it, but the middle is clear so that you can see the wound bed and monitor for signs and symptoms of infection. Or sometimes we put these over an IV site so we can again monitor for signs and symptoms of infection. So that's a Tegaderm. Here we have a staple removal kit. These come pre-packaged. And again, they're sterile. Here's a suture removal kit. Comes with tweezers and scissors. Again, they're packaged sterile. And there we have it. So just some of the products you're going to be using during the skills lab for your wound. This will be fun. Thank you, folks.